for this thing. Okay. Hello, everyone. Welcome again to another edition of Lupus Talks. I'm the program director, Ed Peterson, for Lupus Talks, our YouTube channel. And also, we're on Facebook, and as well as you can go to our website at lupusofnevada.org. Here, where we are educating and giving some sound information for those who are suffering from lupus, the autoimmune disease, and how we can get have a quality of living with everything that's been going on. So we want to build a community and a movement of people getting the right information at the right time when it comes to lupus. So with that, we have Miss Calvini Williams and of course Miss Dolores Olson, the two dynamic duos who also are lupus recipients as well, but they're living the quality life that they want to live on their terms because they're following something that's going to help you all and help everybody. So please tune in every week that we do this. And this is just giving us some insight as we close out this year, 2025, and move into the new year, 2026. We're going to have way more information for you all. And so keep tuning in. Go to the website. You can also donate. Dr. Williams is also an author of her book, Loving God While Living with Lupus.
And Revelation.
And Christina had lupus for the children's side of it. And she has another one coming out, and we don't let her talk about that. But Dr. Williams, you can take it away.
Thank you. I'm honored that you're still with us. Hold on. Let me get this candy cane. I'm honored that you're still with us. But we're going to talk about that. The book is called Revelation, the Final Chapter. And it's a manual that, when you read a certain excerpt in the book, you go over to the other page and you write in what was said. You write in that word. I know it sounds like, oh, that's kids stuff. No, it's not. If you look at your Bible and I ask you read this and you turn around and I said, what did it say? You couldn't tell me. You could not tell me. But with this, you were actually exerting yourself to write down, what is potential, it's this, it's that. So the books should be coming in. They're on Amazon.com, and they're supposed to be coming in today. I ask everyone to go through Amazon.com because I don't want to be carrying and running around with no money. This is the holiday season, and I want to stay alive. So as we go into, we're going to be talking about lupus and Christmas. I think that's so important. And Dolores and I are going to be challenged with this. Lupus and Christmas can be a challenging mix due to potential triggers like stress, cold weather, and overexertion. And that's most important. But with planning, it's manageable. Key strategies include managing holiday stress through delegation, potlucks, online shoppers, prioritizing rest, saying no to overcommitment, dressing warmly to ease joint pain, staying active, and finding ways to contribute to awareness fundraiser like light displays to make the season joyful and meaning. That's so important because I felt overwhelmed when I got back home. The hospital was calling, changing this, changing that, schedule this, schedule that at the last minute. And you don't do people that way. If I got you on my schedule, tell me what it is instead of calling me and tell me, oh, it's been moved to the next day. It's been moved to next week. Well, I have something to do next week. My calendar does not surround you. It doesn't. So you be aware of that too. Let your doctors know that they change on you and you have other commitments and you like to talk to someone and on your calendar see what's good for you, not just the 17th, and that's it. No. So going to over prioritizing and rest, that's so important. You got to have that. I went to go get an eye exam today and the doctor said I was doing well. For my age and for lupus, I was doing well. Even though I have to put something, a pad on one side of my eye at night, tear the other half off, and in the morning another pad. but you have to put the warm eye pad on your eye, and that helps your eyes, especially for older folks. So those are things that I was doing, and I was just overwhelmed. And plus, Lupus in Nevada is participating in the Shriners toys. We were there last night, putting the toys together, putting them in boxes, taking them out of boxes, and putting them in bags. And I'm so excited behind that one. And Saturday will be the toy giveaway. So I'm excited that Lupus of Nevada is a part of that. And that's what we're here for, to help each other. And if I need some help, they can help me. So I'm waiting on Toys for Tots. We haven't forgot about them. Toys for Tots. We got to wait on the Marines to call us up and tell us when to come down there and pick up those toys, so we can take them over there to Shriners as well. So, Dolores, I'm gonna let you jump in here because I can go on and on and on with the little stress holiday. You want to add something?
Okay, well, first of all, I would like to say to you guys that, around the holidays now, or any seasons that we go through, or any day, we should be very conscious to take care of our health. It's very important, and not to overstress ourselves. We got to give ourselves time for rest. It's very important for that rest, because if you don't get the rest, you can break down, and then what happens? You're going to have some complications that can send you to the hospital.
Mm-hmm, mm-hmm,
And so we don't
mm-hmm,
want anything to happen. The
mm-hmm.
thing, if you feel overwhelmed, because a lot of people, and we mentioned about it before, they will ask for you to do this, do that, do this, do that. Yeah, it's okay to help. We're not saying not to not help anybody. We want you to be able to help somebody,
Don't
but
overdo it.
just limitation. If you're not feeling right at the time, you gotta have time to rest, because
Mm-hmm,
like I said, you don't want your body to wear down to the point that it could put you in a hospital. So it's very, very important to get that rest, to step out, and then after you rest, you can go do a little bit more. You know,
mm-hmm,
You-
mm-hmm. And
but the
then,
main thing is rest. That's the key. And stay hydrated too.
and the connection with that festive season, it's a time of joy, connection, and celebration. That's what it is. Bringing the families together, loving on the families. So some of them you haven't seen in a year or some years, and that's the time to sit down and talk and just enjoy each other, celebrate. But for lupus patients, it can also be a season of overwhelming demands and expectations. Like I told you what happened to me when I got back home. You do this, do that, do this, do that. It was, I was over, I was, I was overwhelmed. Um, at the HIPS Lupus Trust, they understand that navigating Christmas while managing a chronic disease illness can be difficult. This year, we want to remind everyone living with lupus that, and I got it on Google, that they should take time for themselves and keep on enjoying themselves. Don't do something that's going to trigger that flare, because it is an invisible illness. And empowering yourself, like the Lord said, to say no. No is a complete sentence. They said that's not a sentence. No is a complete sentence. You don't need to explain or justify, this is me, why you can't attend a party or take on extra responsibility. And I tell them all the time, I don't need to justify why I said no. And I walk away. Prioritizing your health is a strength and not a weakness. You got your journal, start writing down, you got to do this, you got to do that. But when you're in December, everything is just pushed together, and you got to be aware of that, because sometimes you put meetings over top of other meetings, and you don't even put them down because you're in a conversation with your doctor. Be careful about that and make sure that you have all your appointments. Put yourself first. You're ensuring you can participate fully in moments that matter. True loved ones will understand. The other ones will not. The people who care about you will respect your choices. and support your needs. You have to practical strategies is you have to know how to navigate Christmas. Be honest about your needs. Have open conversations with loved ones about how lupus affects your energy. Set limits ahead of time. Commit only to what feels manageable, whether that's attending for a shorter time or skipping certain activities. Plan rest days. I do. Schedule downtime to recharge, especially after big events or outings. Keep celebrations simple. Opt the low-key gatherings, quiet moments at home, or even visual meetups to reduce stress and fatigue, like a cup of coffee. You know, going to Starbucks and have that cup of coffee. It is so important for you to prioritize. That's a big thing, and that's what I heard you saying, Dolores. You have to do that, or you're gonna fizzle out, and you're gonna blame everyone but yourself, and that's just not a good thing to do. It starts with you. Remember that. It starts with you. Isn't that correct?
Yes, setting healthy boundaries is very important. It's not saying that that you're not going to do this and do that for a person. It's just setting your limitation on
Mm-hmm.
things, because we have to set our limitation, because people, they will get you to do this and do that and do that and do that until you wear out. But
Yes.
you have to speak up and say, I'm not able, I don't feel well at the moment, but I will after I rest up. Because if they can't understand that, then just have to leave it to the good Lord for that. Because people will try to get you to do this, get you to do that, until
Mm-hmm.
they wear you out, and they don't realize how ill you are, that you're not able to do all that. And so
Mm-hmm.
when you're setting those healthy boundaries, that's the best thing to do. Just stick up for your rights of your health.
Yeah, you have to. Nobody else is going to. You have to, because they look at you, and you look like nothing's wrong with you. You do. They say, "Oh, nothing's wrong with that person," and it is. It's all inside. It's all inside, and they don't see all inside. And remember, cold weather is one thing that can trigger and worsen your symptoms of lupus. Cooler temperatures can take a lot of toll on most people, even if they don't have an autoimmune disease. It places additional stress on the body. This is for everyone around the world who's listening to this. They have snow. They're having snow overtures. I call them that, over in New York and Buffalo and all of that. They're having more snow than ever, ever, and so they have to dress themselves warmly, and they have to uh, decide what they want to do. They just don't go out because somebody else went out, because you're not that someone else. You have to know that you can trigger or worsen your symptoms. And that's really important, ladies and gentlemen out there. That's really important, because no one knows lupus better than you. It says focus on calming inflammation and suppressing the overactive immune system, primarily using cortisones like prednisone for quick relief. Um, Hydrocortisone, they took me off of that, because my eyesight. So I was taken off that. I don't know what you guys were taken off of, but that's what he took me off of. Lupus is a cruel. What is lupus? Some people say lupus is cruel. The ambassador of the Lupus Foundation America, Rachel Gons, calls the disease a cruel mystery because it's super challenging to diagnose accurately. And I say that slowly, super challenging to diagnose accurately. No two cases are the same. This complexity can make the diagnosis and treatment challenging. And that is so different. If she says she has lupus, she may not have what I have. She has lupus, but her symptoms are totally different than mine. And some people ask, why lupus is called the cruel mystery. And it's called that because Lupus is a chronic autoimmune disease, which means your body immune system incorrectly attacks your healthy tissue and organs. And this disease affects different parts of the body, including the skin, kidneys, joint, lungs, brain, and blood vessels. Some people ask, what happens to individuals dealing with lupus? In lupus, your immune system becomes overactive and creates antibodies that attack the body's cells and tissue. This results in inflammation, pain, damage to your different body organs and symptoms. And that's so important because, again, this is it's a mystery. It's a mystery. And sometimes I just get angry with it because, I suffer with fatigue, pain, joint, stiffness, swelling, fever, shortness of breath, chest pain, dry eyes, headaches, confusion, memory loss, a butterfly shaped rash on my face, and it can be on your thigh because I have a butterfly on my thigh from lupus. Skin gets lesions from the sun, fingers and toes turn blue or white when exposed to the cold or during a stressful period. Ladies and gentlemen, please be careful. Please be careful because this disease is not no joke. Dolores, you have something to say with that? Well, I guess we go on. Um, there's no dedicated test done to diagnose lupus. However, healthcare professionals use a few tests to determine the cause of your symptoms. These tests include blood tests, urine tests, anti-nuclear antibodies, ANA tests, and a biopsy. In conclusion, the disease is called a cruel mystery as it still remains a mystery due to the ongoing challenges faced by researchers, healthcare professionals in dealing with its complexities and finding more effective treatment. The lupus is a chronic condition that requires ongoing management. You cannot do this yourself. You cannot I'm not taking any more of my medicine, I'm just going to do my thing. That body is used to that medicine that doctor gave you. You choose to do what you want to do. And our disclaimer is this isn't for educational purposes. It's not to tell you what type of medication you should get. So that's Lupus in Nevada's disclaimer. We actually deal with helping those to understand the disease, educational awareness, and advocacy. So that is our disclaimer. Um, Though lupus is a chronic condition that requires ongoing management and you can't prevent it, many people with lupus are still able to lead full and active lives with proper treatment and support from healthcare providers. That's so important because 2 nights ago I fell out of the bed. Just fell. Again, I know that's not funny. This has been many falls. And because I had knee surgery 8 years ago, that knee wouldn't bend. My baby brother had a time getting me on that bed. I know it had to be by the grace of God because I still don't know how I got up on that bed. He was pushing front ways, back ways, trying to pull my arm. Now he has, a defibrillator too, and so I want him to be careful of what he does. So it was maddening. I was angry. I to the point, y'all, I said, I give up. I'll sleep on the floor. I just sleep on the floor because I can't take it. If it's meant for me to sleep on the floor, then throw some cover on me and I'll sleep on the floor. Because I was in that much pain and I was angry that my body used to turn all kinds of flips and cheerleading this and cheerleading that and basketball, in high school teams and tennis teams. And now all of a sudden, what? What? So I'm not having a pity party, but I know what I can do, and I know that's important. So we talked about sunlight. Sun exposed may cause skin lesions and trigger an internal response to susceptible people. Infections, in some cases, if you have an infection, it can initiate lupus or cause a relapse. Medications. This disease can also trigger an anti-seizure medications, certain types of blood pressure medications, and antibodies. Please be careful, ladies and gentlemen. Please be careful. And I see my time is almost up. We're going to wish everyone a merry, merry, merry holiday. and Happy New Year. For those of you, Merry Christmas, because we won't be on till next year. I was talking to Ed about that because we have family members coming down this weekend. So I'm going to see what he thinks about that as well. You might listen to a rerun, but I just want to let everyone know that take time for yourself. Don't shut yourself up because a family member is there and he's not, I should say, comfortable with the disease. Don't worry about him. There's other people there. Keep on going. As my mama said, keep on trucking. You'll be fine. So, Ed, are you there? Everybody just left me alone. Edward, they got their pictures up here. Now, you know that ain't right. I'm talking to myself, y'all, huh? You know that's not right. They just leave me in here. I guess they like me talking to you guys. Just leave me. That wasn't
I didn't know
right.
Dolores was kicked out.
She was. Is she back on?
Yeah, I've been back. But I was gonna say some more too before we just cut it.
Oh
Cut it.
yeah,
Off.
yeah. I
I
I
just say
called
that
you.
one thing too
Go ahead.
is protecting yourself around the holidays too, especially to for helping you guys if injuries. If you guys don't be afraid to get protection in for beds or anything like that, because some people may feel kind of funny to have bars around beds and stuff. It's okay to have that because you want to make sure for your own safety in that because yeah, other people, everybody has different conditions that can make them fall off balance. So that'll be more protected for you. So and always be protected around the holidays too, especially when you go to cooking in that because you're not thinking right. Sometimes that
Mhm.
can happen. So just really pay attention to your surroundings.
That's right. You want to wish them a Merry Christmas and Happy New Year,
Christmas and Happy New Year to you guys all.
and we'll be back on. Again, I said I'll talk to Ed about it next year, first part of next year, because a lot of family
Yep.
members.
Yeah, we'll be back on the first of next year.
Okay.
Yeah,
Okay.
next year we'll be back on after the holidays. So, um, yeah, we'll be continuing on with Lupus Talks in 2026 as we continue to share the information on a consistent basis. But
Mhm.
also, please remember that we do have the website lupusinnevada.org where people can go and get additional information that they're seeing, that they want to be a participant, if they want to participate with us in reaching out this nationwide, because this is going to be a nationwide event thing that we're putting together here. So that way you can also like and subscribe to the YouTube channel of Lupus Talks or Lupus in Nevada. And then you can also, again, any questions or inquiries, you can fill out the form on the website. We'll be happy to assist on that front as well. So, any other questions, any other concerns? Anybody else got anything they want to?
Is that the first week, Ed, of
So yeah, let me give you the exact let me see,
date? You
time
just
on
text
that.
it. You just want to text it to me.
Yeah, because yeah, we're going to start back on the Tuesday will be the 6th
Hmm.
of January. So we'll start on the third. Actually, the 13th will be the first start of it.
So the 13th will be
Yeah,
it.
yeah, the
Okay.
13th of January.
Okay.
So we'll be back on the 13th. Yeah.
Okay.
So that'll give me time to get settled because I'm transitioning to Virginia Beach, Virginia during that period anyway. So
Oh
the first
wow.
of January. Yeah, because I'm
You,
house sitting because we have a house now in Virginia Beach. So I want to make sure that that's well maintained and taken care of for my mom while she's in Chicago. So anyway, that'll be great. Anything else, ladies?
no, just Merry Christmas, Happy New Year,
All
Happy
right.
Kwanzaa.
All right. So thank you all. Dolores, any last final statement?
Yeah, you guys have a Merry Christmas and a blessed holiday and Happy Kwanzaa and just stay warm too. Stay warm around the season.
Yes, ma'am.
Amen.
All right. Well, thank you all for this edition of Lupus Talks. We'll talk to you guys again. Happy holidays and Merry Christmas and Happy New Year. We'll talk to you guys again. Peace out.
Thank you.
Right.